I would like to welcome each and every one of you to commemorate and celebrate World Hepatitis Day. That is the 28th of July, which is celebrated all over the world in order to create awareness regarding the dangers of viral hepatitis, especially B, C, and D, and not only that, regarding the different services which are available free of cost all over the world.
Thank you very much for giving me this opportunity to say the keynote address on this special day, World Hepatitis Day. We all know World Hepatitis Day is observed on 28 July every year to mark the birthday of the Nobel Prize winning scientist Dr. Baruch Blumberg, who discovered the hepatitis B virus. Not only that, he developed a diagnostic kit as well as a vaccine for this virus. Observing this viral hepatitis day, as already spoken by the chairperson, gives us an awareness about this disease, about this viral hepatitis, which causes inflammation of the liver, thereby giving rise to severe liver diseases like liver cirrhosis and ultimately leading to liver cancers. So, the observing this all these World Hepatitis Days and other health awareness days, it gives us an opportunity to step up our efforts on hepatitis and encourage actions and engagement by individuals, partners, and public, and highlight the need for the greater response towards the cause. This year's World Hepatitis Day theme is Hepatitis, Let's Break It Down. So this team calls us to dismantle the different barriers caused by financial, by social, and by the systemic obstacles. And the team also gives us or emphasize the need to simplify and to scale up and integrate the different services into this hepatitis control program like vaccination, safe injection practices, harm reduction, and especially testing and treatment of hepatitis.
Viral hepatitis includes five main types, namely A, B, C, D, and E. Symptoms can range from mild to severe flu-like symptoms, jaundice, fatigue, abdominal pain, and in chronic cases, liver damage, cirrhosis, or cancer. And briefly, I want to also mention the types and causes of hepatitis. We have hepatitis A and E, uh, primarily spreads through contaminated food or water, that is through fecal oral contamination. Then hepatitis B, that is HBV, is transmitted through infected blood, semen, and other bodily fluids. Next, we have hepatitis C, HCV, which primarily spreads through contact with infected blood. Then hepatitis D, HDV. It occurs only in individuals already infected with hepatitis B. We also have non-viral hepatitis, namely one, we have this autoimmune hepatitis, which is caused by autoimmune disorders. Number two, we have alcoholic hepatitis, which is caused by excessive alcohol consumption. And three, drug-induced hepatitis, or which is caused by certain medications or toxins. And I would also like to briefly go on the symptoms of acute hepatitis as well as chronic hepatitis. As for acute hepatitis, it causes fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and jaundice. That is yellowing of the skin and eyes. Then we have this chronic hepatitis as well, and which can be symptomatic for years, with symptoms developing as liver damage progresses, causing fatigue, abdominal pain, jaundice, and in advanced stages, cirrhosis and liver failure. And the complications of this hepatitis are, for in chronic hepatitis B and C, can lead to cirrhosis and liver cancer. For prevention, we have vaccines available for hepatitis A and B, then safe sex practices to reduce risk of hepatitis B and C transmission, avoid contaminated food and water to prevent hepatitis A and E. Also, avoid sharing needles. to prevent transmission of hepatitis B, C, and D. Lastly, safe food handling to prevent spread of hepatitis A and E.
2019. So if we look and if we compare with the other national health programs, it is fairly a young kind of a program as compared to program like family planning program or RCH program or HIV and AIDS program. So even even for the implementation also, I would like to just say that there are so many areas which needs to be explored when it comes to the viral hepatitis. But at the same time, as our MD has already highlighted, viral hepatitis is a very deadly disease. We are all aware about it. So even if hepatitis C is curable, but still 5% of hepatitis C infection also goes into liver cancer. Even if hepatitis B, there's a treatment available for hepatitis B, but still 5% of hepatitis B also, despite treatment, goes into liver cancer. And we are all aware that liver cancer is very expensive. It causes a high amount of out-of-pocket expenditure. We are all aware, we have seen our own friends suffering and dying because of hepatitis related liver cancer. And we don't want that any of the Naga people should be dying because of a test which is available free of cost, because of a treatment which is available free of cost, because of awareness which is plentifully available. And also regarding the hepatitis B immunoglobulin, which Madam has also highlighted, all the infants who are born to hepatitis B positive mothers are supposed to get hepatitis B zero dose of vaccination through the UIP division, and hepatitis B immunoglobulin free of cost through the viral hepatitis control program. And all these are items which needs cold chain. It has to be kept in the fridge, and it is not freely available also. So, like when all these services are available for our people, why should we not tell them? Why should we not ask them to avail the services? And also, at the same time, with all these facilities which are available, we don't want to see anyone dying because of these diseases. So I believe even if most of us sitting here are working in the Directorate of Health and Family Welfare, it doesn't matter. One in hand is more valuable than two in the bushes. So each of us should go back and tell our neighbors and tell our relatives, tell our friends that we need to know our status, and that free treatment services are available. Free viral load are available, free drugs are available, free testing services are available.
Hey, exporter. Ito na.